All right, let's dive in. Today, we're tackling a topic that affects, well, a ton of people, but it's often kind of confusing and not talked about enough. I'm talking about vulvovaginal disorders. If you've ever found yourself worrying or just plain confused by certain symptoms, then you are in the right place. We're going to break it all down nice and simple.
You know, things like itching, a strange odor, or discharge that just doesn't seem normal, it can be really stressful, right? And it's so easy for your mind to just jump to the worst-case scenario. So what we're going to do today is decode these signals together. The whole point is to give you the clarity you need to feel more informed and, honestly, more in control of your own health.
Okay, so first things first, let's get on the same page and figure out what we're actually talking about here.
So, vulvovaginal disorders. It sounds kind of technical, but think of it like a big umbrella term. It's basically a catch-all for any condition that affects the vulva, which is the external part, and the vagina. And under this umbrella, you've got a whole range of things. We're talking infections, inflammation, skin issues, even changes caused by hormones. It's a pretty wide category. Now, we can break these down into a few main groups. You can see on the chart here, you've got inflammatory issues, some structural things like cysts, but look at that big slice of the pie. The vast majority are infective. And since that's what most people run into, that's exactly where we're going to focus our attention today. All right, it's time to meet the main players in this story. When we talk about these infections, there are three, let's call them the usual suspects, that are responsible for the lion's share of cases. And here they are. First up, Bacterial Vaginosis, or BV for short. Then there's Candidiasis. You probably know this one as a classic yeast infection. And finally, Trichomoniasis. Really, getting a handle on what makes each of these different is the key to starting to figure out what's going on. Okay, this table right here, this is basically our cheat sheet. It's awesome for telling these three apart at a glance. So look, for BV, the big giveaway is that thin, grayish-white discharge and, really, that distinct fishy odor. With Candidiasis, the yeast infection, you're looking at a thick, white, kind of cottage cheese texture, and it almost always comes with some pretty intense itching. And then for Trichomoniasis, the classic sign is a frothy, yellow-green discharge. Now, you see that note about a strawberry cervix? That's something a doctor would see during an exam. It's just these tiny red inflammation spots. But for you, the biggest clue is almost always going to be what the discharge looks and smells like. So let's really nail this one down. If you take away just one thing about VV, let it be this, that fishy odor. It's really the most classic telltale sign. And when it comes to Candidiasis, the yeast infection, it's the combo that's key. It's not just about the thick, cottage cheesy discharge. It's the discharge plus that really, really intense itching. When you see those two together, that's a super strong signal. Okay, last of the big three, Trichomoniasis. That frothy yellow-green discharge is the dead giveaway. But here's something that's absolutely critical to know. Trichomoniasis is an STI, a sexually transmitted infection. And what does that mean? It means your partner or partners need to get treated too. If they don't, you can just keep passing it back and forth and you'll never get rid of it.
All right, so we've covered the big three, and they are, by far, the most common. But they're not the only things that can cause issues. So let's just take a quick look at a couple of other conditions just so you have a more complete picture. Check this out. Here are two really common problems that have nothing to do with an infection. On the left, atrophic vaginitis. This is all about hormones, specifically low estrogen, which happens a lot after menopause. The main symptoms, dryness and a burning sensation. Now on the right, you've got vulvar dermatitis. Think of this one like an allergic reaction or skin irritation. It's caused by external stuff like harsh soaps, fragranced pads, you name it. And the result is usually itching and a rash. It's just a great example of how the cause isn't always what you think it is.
And just to round things out, here's a quick lightning round of a few other things to be aware of. You might hear about a Bartholin cyst or abscess. That's basically a painful swelling on one side of the opening. Then there's genital herpes, which usually shows up as painful little blisters or ulcers. And finally, HPV warts, which can look like tiny cauliflower-like growths. See, each one has a pretty distinct look or feel.
Okay, so we've talked a lot about the what, but you're probably wondering, so how does a doctor actually figure all this out? Let's demystify that. We're going to walk right through how a diagnosis is actually made.
Honestly, getting a diagnosis is usually way less scary than people imagine. It really boils down to a pretty simple three-step process. Step 1 is just talking. You'll describe your symptoms, your health history, all that stuff. Step 2 is a physical exam, just a visual check by your doctor. And step 3, they might do a couple of super simple lab tests, like a pH test or what's called a wet mount.
which is just a fancy way of saying they'll look at a sample under a microscope. That's it. The whole point is just to get a crystal clear, accurate answer.
All right, now for my favorite part, the part where you get to take control. Now that you have all this knowledge, let's put together an action plan for how to prevent and manage these things.
Okay, if you listen to nothing else, please listen to this. I really can't say it enough. This is all great information, but it is absolutely not a substitute for seeing a real doctor. As we've just seen, so many of these conditions have overlapping symptoms. Trying to guess what you have is super risky. So the single most important thing to take away from all this is always consult a healthcare professional. They are the only ones who can give you an accurate diagnosis and the right treatment.
And of course, prevention is always the best medicine, right? So here are a few simple but really effective habits you can build into your routine. Go for breathable cotton underwear. Please avoid douching. It totally messes with your body's natural healthy balance. If a doctor gives you medication, make sure you finish the entire course even if you feel better. And, of course, practicing safe sex is a must for preventing STIs. See? These are all totally doable, powerful steps.
So, I'll leave you with this to think about. We've decoded the signals, we've looked at the clues, and we've mapped out the path to getting real answers. Now that you're armed with all this knowledge, what's your next step going to be to take charge of your health? Thanks so much for joining me.